Good morning, CFL players. This is Jason Langley from your CFLPA Academy. I'm here joined with an amazing group to join and talk about public health as a career pathway for members once you are done playing football. I'm here joined with a group from the Institute of Health Policy Management and Evaluation from the Dalla Lana School of Public Health at the University of Toronto. Today, we're talking about an amazing opportunity dealing with public health and health leadership specifically that we think is appealing to a lot of players. And we know that a lot of adaptive skills that have happened through a professional football career will be transferable to this kind of pathway. I'm going to pass it over to the Program Director of Health Administration, Karen Bourne, to tell us a little bit more about the program.
Great. Well, thank you so much, Jason, and hello, CFLPA. So my name's Karen Bourne. I am an assistant professor here at the Institute of Health Policy Management and Evaluation at the Dalla Lana School of Public Health, University of Toronto. I'm also the program director for the Masters of Health Science in Health Administration, and very pleased to be joined by three program alumni who are also, one is a former CFL player and the other two are athletes. So really excited for them to tell you about their experiences in this program and how it has influenced their career journey. In short, this MHSc and Health Administration really prepares individuals, a very diverse cohort of individuals, for exciting careers in healthcare leadership. Our graduates work across the health system in many different roles, but a shared thread in our program is that we equip them with the competencies to lead in complex, dynamic health environments. So with that, I'll let our three speakers introduce themselves. Ben.
Awesome. Thanks, Karen. I'll jump in. So my name is Ryan Hinds. I'm currently the Director of Equity Diversity Inclusion here at Dalla Lana School of Public Health. But prior to this life, I was a CFL player, played 3 years in Hamilton for the Ticats, and then 3 years in Edmonton for the Elks, winning a Grey Cup in 2015. And then promptly retiring to keep all my body joints intact. But pleasure to join the call today. And I'm going to pass it off to one of my fellow alumni, Trevor.
Thanks, Ryan. Hi, everyone. My name's Trevor here. I am also an alumni from the Masters in Health Administration program, U of T. And I currently work in home community care as a senior director for a home healthcare organization. And I have an interesting journey, which I'll speak a little bit more to, but kind of my background playing sports my whole life brought me to healthcare. So I'll talk a little bit about that later. And I'll hand it over to Safe.
Thanks, Trevor. Hey guys, my name is Safe. I'm also an alumni of the program. I'm currently a senior project manager at Sick Kids, working with their sort of neurosciences and mental health department. My journey is not as interesting as the rest of the guys here, but I definitely did interact with sports throughout my entire life, and I'm very excited to share my journey and our team's group's perspective with you. Thanks.
Thank you, everyone, for joining. I know that we're going to have a very in-depth conversation, and I know you've already alluded to different pathways that have brought you to public health and to this master's program specifically. If I can start with a football question and then maybe parlay that into your other experiences that if it wasn't football that brought you to public health, but Ryan specifically, can you walk us through your personal journey from playing in the CFL to pursuing a career in public health and even pursuing your education in this field?
Yeah, happy to do that, Jason. So while I was playing for the Ticats, a teammate of mine, we were doing a mentorship program that was in and around the Toronto area. And in that program, we were mentoring lots of youth from underserved populations because we wanted to make sure we gave back, and that's something that we were really interested in. I was also really interested in health. And as we were connecting with students and they were telling us about some of the challenges and we were trying to provide some support to them, we realized that there was so much going on with some of these youth in their lives. It was hard to see the impact that we really wanted to see. And so we stopped and thought for a second. For me, it was, well, if we're doing these one-on-one conversations, is there a way that we can impact more people at the same time? It felt like at times we were fighting a house fire with a water gun. And we thought, okay, well, there's got to be a way that we can impact more people. So when I looked at health and places where you can impact more people at the same time, I got into health systems and public health. And so when I searched places where I can find the education to get a career out of that, I came up with the Institute for Health Policy Management and Evaluation and this MHSc program. And so I had a great chance to apply for that program. And luckily, this program is one that recognizes value and skills from all different sort of walks of life, not just healthcare. And so they gave me a shot. And I think I've parlayed that into something that's pretty successful. So that's how I got here.
You're the gentleman that didn't play in our league, but certainly alluded to playing sports and being around it and having a bunch of different experiences. Can I ask, what led you to public health, and maybe tell me about your journey that led you there? Trevor, maybe you first.
Yeah, absolutely. So me growing up, I played competitive sports pretty much my whole childhood and really, really enjoyed it. I thought for a long time that's kind of the trajectory that I was going to be on until I decided that I needed to pivot a little bit and focused on kind of my education and my schooling. And having two parents that both worked in healthcare, for me, that just seemed to be kind of a natural path. And I was most interested in, at the time, fitness and nutrition. I thought for a long time that I was going to go into sports nutrition, work with athletes in that regard. And that was kind of the area that I was passionate about. So I ended up doing my university education in nutrition, but coming out of that, I got exposed to a lot of great opportunities that were more connected to healthcare leadership and working with a larger team and just having the experience and the ability to be very creative in that regard. And as Ryan mentioned, looking to have an impact on a larger group. So thinking more broadly around, population health, public health, just the community that I'm a part of and how I can help them with their health and wellness. So that brought me to actually transitioning over to more of the home and community care side of our health system. And I worked with an organization that was a not-for-profit charitable organization where I was privileged and in a position where I was able to lead some really great programs, adult day programs for seniors with dementia and Alzheimer's disease, a Meals on Wheels program that focused on supporting those that are low income, that had food insecurity issues. So I really, was excited by that work because I saw the impact. And for me, not necessarily being a business individual, I knew that I need to do a little bit more to kind of help myself in that regard. And that's where the Master's in Health Administration program came in. And now I continue to work in home and community care, but in a different context, working more around home healthcare. But a lot of what drove me to healthcare at a young age around kind of nutrition, body, health and wellness, and then helping others, the communities that we serve, is why I continue to stay in the field today and why I'm passionate about it.
Thank you very much for that perspective. I know that there's certainly players in our cohort that have that same interest, if not same training, that led you into this pathway. And Saif, can I ask for your perspective on this, knowing that maybe it's even, very different or similar based on your experiences?
Yeah, for sure. So as I sort of mentioned, I'm an engineer by background, but growing up, I played a lot of sports, whether they were team or individual, mostly a lot of soccer and tennis. I think must have been the age of 13 or 14 where I realized I'm not doing this professionally, maybe even a bit younger, right? I'm probably not good enough. So, you keep continuing to play sports as you grow older because it's a big part of your life. But, went into engineering school at U of T, and I did a 16-month internship during my time when I was in engineering school in the banking and consulting sector. And I realized it wasn't really my thing. Didn't feel, a lot of impact or the passion in the work that I do. I was very lucky to have done a healthcare system design course in my undergraduate with some amazing engineering professors. So I went back and I did some research work with the professors at the Center of Healthcare Engineering at U of T. And I was very lucky that it was around, well, lucky is a relative word, but around the time of COVID as well. So there were a lot of wicked challenges and issues to face and to try to solve. So, a lot of interesting projects. And that's also when I joined the first healthcare organization named Michael Garron Hospital. And I started with their quality improvement and operational excellence team. And then, just started getting my fingers, just deeper and deeper into it and getting more involved. And sort of from Trevor's perspective, a lot of engineering, very little of maybe those soft skills and the business knowledge, and even the deep healthcare knowledge and expertise that I felt like I needed at, not an accelerated pace, but sort of at a very condensed pace as much as I can. And I think the 2-year master's program, the MHA, was excellent for that. And then, came back, I was able to do that while I was working, and sort of came back and worked in a lot of strategy roles. And now I'm at Sick Kids with the brain and mental health team.
So what I'm gathering from the three of you is that there's probably a lot of overlap in your characters, but you lived very different pathways to get to this same kind of health leadership career. And I think that's, we talked about it off the top, but with our membership, I know that we've got a wide, diverse group of individuals with a bunch of different lived experiences, but those soft skills oftentimes have been honed from those similar experiences through football. And I think a lot of those things do potentially transfer into this. And I know from our initial conversations, the ones are like resiliency and grit, being able to take coaching and being able to adapt. And really, that's the next question that I have for all of you in terms of challenges and adaptation. So what are some of the biggest challenges? And I'm going to start actually with Saif, just based off of just hearing you, but shifting from the engineering side that was maybe not in this world of health initially for you. Did you face any challenges trying to figure out, how you would apply these skills that you knew you wanted to do something? Is that fair?
Yeah, it's very fair. In engineering, we get very little to honestly no exposure to clinical terms like pediatric or just like the clinical world. So I think I had to build like that knowledge up from a biology and healthcare perspective. I think you alluded to something there of I love working in teams. I've always done that growing up, and I think it's something that we're very privileged to do if you're growing up playing sports. I love working with people, but I think my biggest challenge was bridging my sort of engineering, very process oriented mind to the healthcare world, and knowing what I need to sort of slow down in and what I need to pick up on, and what I need to just improve in terms of communicating. So really, the knowledge, and then being able to just communicate and bridge the gap between my knowledge and the new knowledge that I'm gaining, so I can actually help in the field.
Trevor, can I ask you the same question?
Yeah. So for me, again, similar to say playing sports, pretty much my whole life, still do. Very comfortable in a team environment, very comfortable receiving constructive feedback, resonate with some really great coaches or leaders through my lived experience. And transitioning into healthcare, for me was natural, was really interested in it, but I didn't have that knowledge, and I would say that understanding of how the system works. So looking at it from a 10,000 foot view, how does our health system work in Ontario? What's the government's role? Who are the key players, looking at policy items. And I would say, the master's program really helped to fill that gap. So for me, I felt comfortable coming into an environment where I'd be working with a team. I'd be working, and fortunately, I'm in a role where I get to lead team members as well. Nutrition, health, all of that really resonated with me. But in my leadership journey, having to learn about the system and how that kind of interconnects and, across various sectors like the hospital sector, public health, home and community care, long-term care, primary care, that was an area that was kind of a gap. That was a real challenge. So I, intentionally seeked out programs like the one here to fill that gap and help to give me that information so that I could be more confident in my role, but also be a more effective leader and work more effectively with my team members.
I can't imagine a CFLPA member not resonating with that. But Ryan, I'm going to put you right into those shoes. So same question for you, but right off the CFL field into this kind of thinking. What challenges and adaptation did you see in yourself?
Yeah, that was tough. It was tough. I think for athletes and folks who end up playing in that at that level, your whole life you're defined as that thing that you do. Like you're an athlete. Like from high school, from even younger than that, and as an adult, you're defined as that athlete thing. And now when that goes away, you got to redefine yourself. And that redefinition is the thing that's really, really tricky. And for me, I had to figure out, well, where was my experience and the things that I developed? I'm like, I know I've got some good skills here, but where can that actually fit? How can I turn that into career? There's obviously places where you can go in coaching and things like that. That seems like that's a natural path for a lot of folks, but there's other paths to go. And for me, I had to figure out, well, what were the skills that I was bringing that are valuable in places that I was interested in, and I was interested in health. So, figuring out that the teamwork thing, that's something that I feel like being a professional athlete, I've got a PhD in, I've got a PhD in teamwork. I've got a PhD in collaboration. I've got that sort of degree in how to collectively bring people together for a joint goal, and bringing 90 guys to work together as one. Those are things that are really valuable, especially within the health field. And so I think that transition, when you got to go from, a professional athlete, CFL, to healthcare, you're learning, I think Safe mentioned, like, you're learning a bunch of new terms that you just don't know. You're learning a healthcare system that you know from just one side of it. And you're trying to figure out this whole world that you're joining, but it really is like you're going to a new team and you're learning a new playbook. So we realize it's something that you've done before, right? So you just got to learn those plays, learn that system, learn the environment that you're in. And I think we all have done that. And really, that's what this program does. It gives you a chance to learn the terms, learn the playbook, learn the system, learn the environment, give you the networks. So for me, that transition was tough, but it was really good for us to be able to find a program that can help me with that transition and redefining myself.
So the next question was going to be skills transfer, and each of you answered in that same question, basically both questions that I had for you, because ultimately what you faced in your challenges, coming into this, was the fact that you had already built yourselves up to be, I think, remarkably, ready for the challenge. It's just a matter of filling the gap. And it sounds very much like the master's program that you all went through, you're speaking very favorably for, and something that I think our members probably could benefit similarly from. So I appreciate all of that. I'm going to move right into the pivotal moments question, if that's okay, and just ask to you, Ryan, specifically, and then I'll move to the group. Was there a specific moment or experience on or off the field that made you realize that this public health field was the one that you wanted to land in?
Yeah, I think that experience, sitting down mentoring one of the youth that we were having conversations with, and she was talking about all the things that was sort of stacked up against her, and I was like, yeah, there's got to be a way to have a broader impact. And so I think for me, that was a pivotal moment for me to say, okay, you know what, I was interested in health. This is the way to go. And, in those conversations where I was figuring out, well, how are we as CFL players really, really suited for this? I thought about the fact that professional athletes, there's like 1% of the world, or less than 1% of the world that's a professional athlete. Maybe less than 2 goes from college sports to professional sports. So we're not deterred by big challenges. And I know that sort of in healthcare, there are big, wicked challenges. And so we are folks who are ready to take on big challenges. So I'm like, okay, that can be me. I also know that we're used to failing publicly, like no one else, right? Whether you're missing a block, I know as a DB, for me, when I get beat, I got beat deep and it's a touchdown. That's 6. So, and I'm seeing that play on Sports Center, so failing publicly is something that we're good at bouncing back from. Because, when that happens, there's no, coach, can I come out and hide my face? No, I got to go back on the play the next series. So I know we're used to failing publicly and then bouncing back, right? And I know all the things like teamwork, sacrifice, resilience, all that kind of stuff that fit right with this sort of area of work, public health and health leadership specifically. And so when I looked at the program that sort of actually enabled us and encouraged us to use those skills, I thought, yeah, this is something for me that is a different direction than where I thought I wanted to go.
Thank you very much. I'll open up to Trevor and Safe. I mean, it doesn't need to be an answer, but was there a pivotal moment that you found in yourselves, knowing that this was kind of the landing spot for you, but health leadership and public health generally?
Yeah. So I would say for me, it was just natural to go into healthcare again because that's where my passion was. It aligned with my values. Both my parents working in healthcare, so they instilled in me and my sister at a young age that, health and wellness, health is your most important currency in many ways, right? So that was natural. I think what was a pivotal moment for me was shifting my mindset from saying, maybe I want to do sports nutrition or I want to kind of go into coaching and I want to kind of pursue that avenue, to saying, maybe I want to do something around healthcare leadership. I want to do something around kind of bringing a team together on a shared goal, shared purpose, and really being ambitious and bold in that. So kind of as Ryan spoke to, thinking about how we can impact the most people, how we can really pursue a wicked problem or a challenge that may seem unattainable, but in many ways, chip away at it, chip away at it, chip away at it. So for me, working in home and community care, that was an area that I saw as a real opportunity. We hear constantly from people that they want to live at their home as long as possible. They want to remain independent. That's what matters most, be with their families, be with their friends. But it was a real challenge for many reasons. So I pivoted my way of thinking from saying, okay, maybe I'm not going to work as a sports dietitian, but maybe I'm going to tackle this problem. I'm going to try to think about how we can offer programs and services to those that perhaps are more vulnerable, that don't have the means or the resources. We're going to focus on making sure that, my grandmother, as an example, somebody who needs that care in the home because she wants to live in the home that she's lived in for the last 50 years as long as possible, is going to get that in-home care. It's going to get that support so that she can remain healthy and independent. And thinking about how we can impact, not just one individual, but our communities. And that fired me up. That made me really excited. And just the fact that I get to do that with the team day in and day out, we get to have that shared purpose, that shared goal, and really try to be creative around how we go about it, knowing that it's important and meaningful work. That's where my mindset shifted towards saying, yeah, let's do something that's got a major impact and something that I can be really proud of when I'm done working, whenever that day is. So
I'll definitely say that passion seems to be something that I think is running deep in all of our panelists here, and something that I think runs deep in our athletes as well. So that's another piece that I think is just palpable. Safe, can I ask about you and any?
I think your sound may have cut off for just a moment there.
Sorry about that. Yeah, sorry. I was
No,
posing to you, Safe. Yeah, absolutely. If you don't mind talking, if there's a pivotal moment that you saw, and obviously having gone from engineering and wanting to potentially, again, maybe it's a passion play like we were just talking about, having an opportunity.
Yeah, absolutely. I think the one thing, one of the many things Trevor said, but the one that stood out is the impact piece. When I was in the private sector, I was in consulting for some time and then banking, and it was very hard because you didn't see the effect of what you did. I think the pivotal moment for me was when I first joined healthcare, and I actually saw and met the patients and actually saw the impact of work. I think it must have been a year or 16 months into the role when I joined Michael Guerin, and especially around the time of COVID, and trying to serve, whether it's underserved patients or just generally any patients who are confused or a bit scared. They really don't want to be in a hospital, but you're trying to make the experience as positive, as helpful as possible to them. And I think my contribution to that is what really was the pivotal moment for me. In my current role, I try and going to the clinics that are under the portfolio that I serve almost every day, just so I can interact with the frontline staff and see the patients. I think that's something that's really, really just, I think every leader should probably do that, because I think it's just very important. In terms of, what this means for me in my role in healthcare, I'm still trying to crystallize that a bit more, because there are some amazing people in our healthcare system, but our system unfortunately isn't ideal. So we have to try to see what we can do with, whether it's technology or whether it's system design, to actually improve how we deliver healthcare and how we serve our population.
I mean, I appreciate that you're acknowledging the reality is that, it's a barrier and opportunity. And I think that you're all taking it on as an opportunity, it sounds like, with the passion and with the training. And maybe specifically back into the training. So the masters that you had that kind of filled the gap in public health, and Safe, I'm going to stay with you if that's okay. A lot of our members have not walked that different path. And so they might need a little bit of mentorship. They might need to have conversations throughout this if it is right for them. I'm curious, in your experience, did you have those kind of opportunities during your masters, and maybe just define a little bit what that meant to you?
Yeah, absolutely. That's a great question. I think before I jump maybe to the support, in the part of the masters, I think the one of the biggest things it also gave me is perspective. The different roles, what people do, how much every single role and every single degree really brings a very important point of view and something to contribute to the table, whether they're a social worker or a nurse or someone who is, a doctor by background, whether it's in their home country or in Canada, even a dietitian. But it's really, there's no shortage of perspective, which is the beauty of it. And I think the other one is from a mentorship perspective. I was very lucky to actually connect with one of the leaders in our organization through sports and our love for a certain sport where we sort of got to know each other better. And then he was very kind to take me under his wing. So that was before the masters. And then during the masters, I took advantage of one thing all our faculty members say is take advantage of your T card. Take advantage of your email, your Toronto email, and reach out to people, to higher ups, because people love helping students and they love meeting students. And I was very lucky to, have been given that piece of advice and try to take advantage of it, and have met different leaders, whether it's in family medicine or within a hospital or even health tech, and sort of have them as people who I try to counsel and get advice from and get support from whenever I need it.
As I'm learning more and more, and I thought I was well read, but I'm clearly not as well read as I was before this conversation. It seems, interdisciplinary is clearly a term that applies here. And it seems, even with regards to, the programs, the strategies and the mentors that you have access to, you have a wealth of knowledge to tap into. Is that fair?
Absolutely.
And Safe as well, yeah. Trevor, can I ask you, and I not put anybody on the spot, but Trevor, Ryan, even with regards to what you know from the player side and it being, novel, can I ask about your perspective and your experiences?
Yeah, so I would say the program was great. It was an exceptional experience for me. In addition to not only just, the knowledge building that occurred from learning about different subjects or, different topics, it had a very, very strong team component, which again resonated with me. There was group project work in most of the courses. So you not only get that flavor of doing some individual work, but a lot of group work and figuring out how to work with different people from different backgrounds, different experiences, different skill sets. So that was remarkable to get that experience and to really be able to kind of thrive in those environments and learn from each other. The professors were wonderful. Like the ability to reach out to the professors and say, hey, curious about this. Could you tell me a bit more? Could we grab a coffee? Could we jump on a call? Very, very willing to help students in the program. And in a way would act as kind of that coach for you to kind of help you with some of those areas that maybe you're curious about, or, you needed to learn a little bit more about, or you just wanted to have good discussion. The other thing about the program that I found really beneficial was the practicum component. So in the program that we did, there was a practicum as well, which allowed me to actually go into a new environment and apply some of that learning and some of those skills that maybe I had been enhancing through the master's program. So talking about kind of going to a completely different environment and having to kind of figure it out, that was, I would say, a good testing ground for that. And again, everybo's very supportive. So their shared purpose or goal is to help you learn, is to help you to really get the most out of the program. So I just felt like it's a very supportive program. It helped me in many facets, and I take those connections that I made with fellow classmates, with some professors. I still take that forward today. I still reach out to those folks. I've had lunch with some of my classmates recently. So those are powerful, just making those connections as well.
I kind of tap into your lived experience from our group, because I think everything that both Saif and Trevor said already applies to our members. I'll just tap into you having lived it more than I did.
Yeah. So one thing I'll say about the structure program that I knew had to be structured this way, otherwise I couldn't do it, was the fact that it's an executive program. So it lets you work while you're doing school. So for me, when I was coming out of the CFL, I was like, I can't afford to just not make money for the next 2 years. And so I was able to find a job and work full time and find work through actually my practicum. I think my practicum opportunity gave me like I was working before I finished my program because of the networks that I made. So because of that structure, it allowed me to try the stuff that I was learning in school in a healthcare environment and get that experience that I felt like I was missing. And so that structure, that sort of you're in class for maybe 3 or 4 days at a time, and then you're off for about 3 weeks where you get to go work full time, make money, all that stuff. For me, just logistically, I needed that. And so I'd say, based on that, and if I think about the other things that sort of Trevor and Saif mentioned, the program really is structured to take folks and give them that opportunity to learn. So when you're on your at your practicum, folks are trying to give you that opportunity to learn and gain experience, because that's really what it's about. They know they're training leaders. And so for me, one of the things that I purposefully looked for when I was trying to find places to go was people who saw value in the things that I could bring. I know that everyone brought different things, and maybe mine was particularly niche, but a lot of folks were like, oh, you played in the CFL? That's really interesting. Let me have a coffee with you. And I think a lot of our players can use that when they go into something like this. Like don't underestimate how valuable and how interesting that is to people, because you're coming from that world and are interested in going to a world that's healthcare, that's about helping people. Let me learn more about you. And so people sort of bought into you. And once you find your champion, I followed those folks, and those folks opened up doors for me that I think I wouldn't have had otherwise. So I'd say, for me, that structure was really, really critical. And then the opportunity for folks to sort of recognize things that you can bring that you may not even know you bring. They meet you and they see things in you that you don't know is going to be really, really valuable down the line. And so they helped me walk that path, and lots of them are still helping me walk that path. So I'd say those are things for me that are really, really critical and valuable.
You said everybody is referred to the teamwork, and this is something, Karen, if you don't mind if I put you back on the spot, but it seems almost one-to-one talking about football players and obviously teamwork being crucial. It seems it's crucial here, but not only crucial, it's built right into the program. Is that fair, Karen?
Yeah, that's correct. So the MHSc program, as Ryan's mentioned, is a professional master's cohort based. So the classes take place with essentially the same group of around 35 to 40 individuals. And we build teamwork and group work right into the program. So many of the assignments are group assignments. Folks are not working in isolation, and those groups that the assignments take place in are actually held for a couple of semesters across the same courses. So folks have an opportunity to work together in their policy course, on a presentation, and then they'll be working on a statistics assignment. So different members of the group bring different skills and experiences into that group, and people really have the opportunity to learn from each other, rely on each other, learn to communicate really effectively in a group, and support each other through the program and support their learning. So there's that group element of the program within the assignments. And then there's also quite a lot throughout the classes of group discussion and group learning. The professors are not standing at the front of the room talking at the class. They're really facilitating so much discussion about the experiences that are brought into the room from a very diverse cohort of individuals. So lots of opportunities for co-learning as well throughout.
Very much. And it's funny because I constantly try and bring out analogies or likenesses back to football, but Ryan, you're describing the practicum as well as the in class. Well, to me, it sounds like you've got your film study and you've got your practice or game day. And then, game day is maybe the better analogy for getting that job that you pulled out of practicum, which is you getting the job from practice. But there's just a lot of parallels here. And the other thing that I was thinking about is this is a new pathway that we're even talking about as an academy, but it doesn't feel new at all in a lot of ways. Our members have historically found themselves immersed in the community while they're playing. That's one thing I can tell you about the CFL, and hopefully you all know about our players, is that I don't think there's a professional league that's more integrated with the community. And from that, we've seen policing, we've seen firefighting, we've seen community service in general be a primary angle for our members to desire to keep that passion alive, I think, beyond playing football. And so really the last question that I'll pose to this whole group is, now that you're immersed in public health, how do you feel that, is your work making a difference? Is it aligning with that passion? Because I think that that's a big part of anybody's, satiety in a career, but certainly what brought our players to the CFL. That's an open to anybody on the call here.
I'll turn to my teammates here first, and then I'll jump in last. Yeah.
Maybe I'll.
Yeah. Go, Trevor, please.
Yeah. So I would say the passion is still there, still burns, and again, I get the privilege of working with a phenomenal team, both within the organization that I work for, but also in other organizations, and we all have a shared purpose or goal, right? Which is providing the best healthcare services possible for those that we serve, who live in the community, who live in the country that we live in, right? And what energizes me is definitely where we have some of those wins. So recognizing that it's an ambitious goal in terms of saying, we want to have the best health possible for all Ontarians. It's ambitious, but where we have those wins, that's what motivates us. That's what drives us. And I'm sure it's similar for the players as well. Where you get on a hot streak, you're winning games, or you get a big win against a competitive rival. That's the stuff that really fuels you. So I've been privileged in my career where I've been able to be involved in some really meaningful programs that have helped those in the community really access resources in a way that helps them with their health and wellness. I've been involved in some really great work at a high level around just kind of our system and how can we work more collaboratively to provide services to people in a different way, a way that maybe they've never experienced or used services before. I've been fortunate to work with some phenomenal team members, mentors who have acted like coaches in many ways to me and have really groomed me and helped me to kind of evolve and grow in the realm of healthcare. And that's the stuff that just keeps me coming back for more, if I could put it that way. It's the environment, it's the team, it's those small wins that we know are working towards a bigger win, which is that ambitious goal of helping Ontarians with their health, and seeing kind of the impact of that. So really seeing what that means for those that benefit from those programs and services. It's energizing, it's exciting, and I think just being able to give back and contribute and help others really is just it's at the heart of what we do as people that work in healthcare.
I couldn't have said it any better than that, Trevor, honestly, and very, very well put. I agree with really everything you said, because we really truly do see the impact of the work that we do with our patients, and it is a very team-based sort of job and industry in healthcare. You can't do anything alone. The same as most careers, but I think healthcare, especially the social capital that's required, and the amount of collaboration, and Jason, the interdisciplinary collaboration as well. It really is very complex. It's very challenging, but it's also a lot of fun. And I don't think I've ever seen or experienced something as rewarding as that. Except maybe when I do train, or when we were younger, and then we'd see the results of all our training. But this is something that I can really compare to that.
Maybe I'll just jump in before giving Ryan the last word, which is to say, healthcare is all about the people, all about relationships, and our program, the MHSc Health Administration, is very much about that, about building your network and about going through the program in a very supportive network with a group of folks who not only support you professionally, but are friends and collaborators and teammates. So, Trevor and Safe have really covered the impact out there that one can have in people's lives in healthcare, but within the program itself, it's really all about the people and the relationships as well that we try to really foster and facilitate.
Yeah, and as it's like for a lot of us, when our teammates do a really, really great job, our job becomes really easy. And so, couldn't describe the impact that we have any better. I'd say, for the CFL guys, we have impacts in different ways. Whenever we do community programs, we're reaching people in different ways, and this is just another opportunity to do that. And for me, I think the opportunity for me was doing that in a broader scale, and knowing that when we talk about, the system needs to change and things need to be better for that, this is an opportunity to actually have a chance to change that system. So when I see the opportunity to sort of make huge change and sort of think about like the legacy I want to leave, I think about the opportunity to go from leaving a great legacy in the CFL and then leaving a great legacy in the other half of my professional career. And for guys who think or who are unsure about whether this is something that they could do, give it a shot. Like you just don't know the trajectory your life can take and the impact you're going to have. Encourage everybody, because I know I played with lots of guys who I know would be amazing at this stuff. Lots of great leaders that I played with on my teams who, I'd follow those guys into battle. And if they were my CEO right now, I'd follow them in there too, because they were just really, really great leaders and knew how to tackle wicked problems and bring everybody together. So I think if you're looking for an opportunity for impact, not a place you're going to find that has a greater impact than this. So I'd say, folks, give it a shot and see how it goes.
Well, you alluded to a great team that you got to lean on. I don't have any final wrap-up comments based off of your conclusion there. And so all I would like to say here is thank you. Ryan, Karen, Trevor, Safe, I really appreciate your time. I appreciate the deep dive into not only the master's program, but this career trajectory as well. It sounds like a lot of our players should be considering this as a pathway based off of their, amazing skills, but it sounds like a lot of people beyond our membership, if you don't know that this is a pathway and a program, maybe it's something to consider for yourself as well. So for all the CFL fans that might be finding themselves watching this as well, maybe we look up at the Dalla Lana School of Public Health at University of Toronto.